I remember the doctor told me that I had busy breasts, and I didn't understand what that meant because when she took the ultrasound, she said she needed more testing. And I thought it was one fits for all, you know, which is like, khalas, ultrasound, and then you get, in case you need a mammogram later on. But apparently, no, it's not one fits for all. So can you guys tell me a little bit more about who gets what time do we need an MRI, when do we need an ultrasound?
This is why we call it the multi-modality perspective. Whenever we deal with the breast, it's not only one modality. So we can start with the mammogram, we can start with the ultrasound, or
regardless the age.
This is it. Normally 40s we start mammograms, but then with young patients, sometimes if they are at a higher risk, we start earlier. But then again, mammogram alone may not be enough. So this is why we do ultrasound. Sometimes we do MRI. So the multimodality approach is very, very important. It's like, I always call it like a piece of puzzle. We need all together just to have the final assessment, just to be able to give the final assessment actually. And then whenever they told you it's a busy breast, this is it, busy breast, dense breast, heterogeneous. We have multiple types of breast density, and this is very important because the high density, the higher the density is, the harder is to detect small tiny cancers, and this is why we have to do multiple modalities. Like Simone, we may go for the MRI, we may go for ultrasounds.
Yeah, I totally agree, and I want to emphasize on this thing that people think that all breasts are similar. Actually, no, because the breast is mixture of fat and gland, but some people have very fatty breast where the mammogram is enough, though others have like more dense and condensed gland. That's where we need the ultrasound and MRI. Whenever we need extra to make our diagnosis more accurate, we will go for it, just for the purpose of and the good of the patient actually. That's again for the multimodality, necessity of multimodality to make the diagnosis full and with all what we have in hands to make it more accurate.
So even for surgeries, like, does it make a difference if the breast was busy or not busy, not dense as enough?
Indirectly, so through the multimodality approach where you need multiple pieces of the puzzle to know exactly how to plan the surgery. So in some patients, it's safer to go for an MRI or even to make things more complex. Recently, we started using the contrast-enhanced mammography, for instance, just to guide us exactly to the extent of the disease, focality of the disease, and guide us how to plan the surgery in a safe and sound way to treat the cancer and also optimize the aesthetic outcome for the patient. And I suspect when it comes to the dense breast, the multimodality is even more important in younger patients. And that leads us to reach a stage where actually we need to use sometimes all of these tests to accurately diagnose a certain condition or breast cancer, for instance.
Actually, this dense breast concept now is becoming more and more highlighted. Now the FDA recently, like the 10th of September, now they had an announcement like every facility who is doing mammograms have to inform patients. They has to inform patients that they have dense breast. Why? Because mammogram alone will not be enough, and patient can have small cancer. She can have a small cancer still not visible in mammogram, and this is why she has to know that she has to go for another modality test, and this is very, very important. So now there's talking about dense breast, the percentage of having a higher possibility of breast cancer with like density type 3, like it's 1.2, density type 4, it's 2.1. So it's just something that people or ladies has to be aware. They have to know that it's a kind of sometimes it can be a false reassurance with only mammogram, and this we go back to the multimodality. But again, it's not only the dense breast and multimodality, it's the high risk patients as well. We always, whenever we have a patient in our facility, we run this kind of score, like risk score. So that means where she is in her risk of having breast cancer. And then if she's in a higher risk, we can go for another modalities depending on the recommendations and the guidelines, like we can go for MRIs and contrast mammogram.
And the factors that affect this risk are a lot. First, of course, age, family history is very important, her uptake of hormones during her life, and the breast density is also a factor, unfortunately, though people with dense breasts should not freak out because it's very common. Actually, dense breasts are more common than fatty breasts, but it higher their risk, but it doesn't mean that they should really be scared about it, but it makes the risk a little bit higher. And much more factors that we add to make this risk, to calculate this risk, and then we see if this patient needs extra investigations like MRI, of course, or contrast mammogram. We have very new actually techniques and modalities to add to our diagnosis.
But how can a woman know that she has dense breasts? Like, for example, I didn't know until the doctor told me.
Of course, you cannot. You can.
So the doctor can only say that.
The doctor on physical exam, you can know that the patient is high, has dense breast. And for the lady itself, actually, the texture of the breast, whenever it's all lumpy and all, this is a heterogeneous dense breast.
Mine wasn't lumpy.
It was not?
No, it wasn't.
What do you think, Bashar?
Clinically, you can lots of the times tell. So it's like a harder, more nodular breast. You can tell, but it's much more accurate when you assess it radiologically, really.
But sometimes it's tricky, huh? Sometimes from the outside shape you can say it's a very dense breast, then it's fatty, but it's rare times, but it happens.
Yeah, again, I want density of the breast is a risk factor. But then again, whenever we're talking about the high-risk patients as well, we want to highlight that it's an accumulation of risk, many things coming together, like the family history, the fact of having kids or not, the hormonal treatment. It's a kind of accumulations of risks. And this is why ladies have to be aware so they can start screening earlier. And whenever they visit their doctor, their gynae, their breast surgeon, whatever, this will be highlighted. And we have in the hospital, we have something called the high-risk clinic for high-risk patients, which is really very, very important because whenever you are a high risk, you don't know what to expect. Shall I get a genetic test? Shall I go for whatever MRI? Shall I do mastectomy, like Angelina Jolie thing? It's just very confusing. So whenever they go and have this consultation with the high-risk specialist, they will go through all, if you need to do the genetic test, what you need to do, what are the exams that you have to follow. This is very, very important, actually, and very informative. Yeah,
it's interesting, especially the BRCA testing. A lot of women are scared to do the BRCA test to see whether they're negative or positive, or they're carrying the gene in that case.
Actually, it's not indicated for everyone.
Yeah, because mine was negative.
Yeah, but
so I still had cancer, so it's still not.
Why did you decide to do it, or why?
No, it was after my diagnosis. Okay. It was after my diagnosis. It was later on. They wanted to know if it was genetics or if it was something. It was just more intensive testing after surgery, even.
The thing that if you have, normally, if you have a family history, that doesn't mean that you have the gene.
True.
And if you don't have a family history, that doesn't mean that you don't have the gene.
So you and your luck.
Yeah.
That's why maybe Kinda, we should say to all patients that trust your doctors, follow their instructions, and
exactly.
And visit the right doctors. I mean, go to see a breast specialist, see the radiologist, get your test done. Even the breast surgeon or the breast specialist will send you to the radiologist to get an ultrasound. I mean, probably yes, they'll do the manual check, but they'll still send you to get an ultrasound. And I think that's very important if you go step by step to the right people.
Exactly.